It's a pleasure for me to introduce you to one of the Inclusivity Project's research fellows. Although Esmaeil and I have chatted quite often on Teams, this is actually the first time in 2 years we've ever met in person, so it's quite exciting. I'm doubly happy to hand over to hear Esmaeil's very fascinating research. I know he's going to talk about some of the maps he has created, and I appreciate it's going to be quite difficult for you to see them, but for some of you to see them on these screens. So if you have one of these on your table, or if you would like to just get hold of one, there are plenty at the front desk. And turn to the back page, there's a slightly simplified version of the maps, which you might find a little bit easier to follow. Esmaeil, I'm delighted to hand over to you. Thank you.
Okay, thank you. Hi, my name is Esmaeil. I'm coming from a systems thinking background. In system thinking, we try to, pick up, I can say, bird's eye view and see the things in their wholeness. Like I can give 2 examples, like this building. Like you can just see this room, but if you take a bird's eye view, you can see whole the building, the rooms, how they interact with each other, how they lead to each other. You can see the wholeness indeed. The second example is like, COVID. Like, before COVID, we didn't know that how many things we are interacting with, how many people we are interacting with. And then suddenly the virus was there, and whatever you were touching, like they were thinking, there is a virus. So so it showed us that we are living in an entangled web of relationships, a lot of relationships, complex relationships indeed. So we take this approach to understand the social problems. And when I joined the Inclusivity Project, we were thinking that can we take this system thinking approach and look at the employment problems for disabled people, people with long-term health conditions, and older people. So I've got 2 presentations indeed. I'm going to show 2 system maps indeed. One, the first for disabled people and people with long-term health conditions, and second for older people. Older, I mean people over 55. So as I told, the question for us and for me was that, okay, what are the conditions that shape the employment practice of businesses and disabled people and people with long-term health conditions in Cornwall? What are those conditions, factors, and how they come together, sit together, and shape the employment outlook, or I can say ecology, in Cornwall? So to reveal that factors and the relationships, I did a couple of interviews with people. At first, we were trying to run a couple of workshops, but COVID happened. I ran my first workshop, COVID happened, and I went to the interviews then. So like for the disabled people, I did 36 interviews, with disabled people, SME owners, and HR experts and policy people. And then I tried to translate those qualitative interviews. By interviews, I mean I was going and sitting and talking to people online, talking to people on the conditions and factors that shape the employment experience of disabled people, and employing them for businesses indeed. So this is the map indeed. I hope you can see it. It's just a bit small, but it shows that there are lots of factors that are influencing the employment of disabled people and people with long-term health conditions. To keep it short, I'm just telling the disabled people, but it includes the people with long-term health conditions as well. There are lots of factors that shape the employment profile of disabled people in Cornwall. Like I can give a couple of examples to simplify this complex map, but like one of the things that especially businesses were telling me was that, we say reasonable adjustments, we say that adjust the workplace, but for a business, that comes with something, that comes with fear of cost. And when I was telling reasonable adjustment, they were telling that it opened something for me. And I was telling, okay, what is that? They were telling that fear of cost. And I was telling that, okay, what that fear of cost leads to, because I'm going to see the interactions between the factors indeed. I'm going to see how all the things interact with each other and shape this complex system indeed. So they were telling fear of cost, and I was telling that, okay, fear of cost leads to what? They were telling that we are risk aversive. Like, I see the reasonable adjustment, the concern about cost comes to my mind, and I don't go to employ disabled people because it is a risk for me. I'm a small business, like it's a lot of cost. And I was saying that, okay, you are risk aversive, like you don't employ, then what happens? And then they were telling me that, like, because of risk aversiveness, I'm not, motivated to employ. And I was saying, okay, they were saying that I don't change the recruitment process. I don't make the recruitment process inclusive. And I was saying, okay, then what it leads to? It leads to low level of, disabled people employment in Cornwall. I was saying, okay, that is like all the graph is showing. And then I was saying that what that leads to. And they were telling that leads to lack of experience in, inclusive employment. Like, because when I'm not employing, what happens? I don't have the experience of employing. And I was telling that, okay, what that leads to then? And they were telling that my awareness, because I don't have that experience, my awareness about the regulations and supports out there is not high. So like, access to work is a regulation, but as I'm not practicing it, because of the fear of cost, as I'm not practicing it, so I'm not aware of those regulations, how those regulations are working. And I was saying that, okay, what that leads to then? That lack of awareness about regulations, fear of cost. Why? Because I don't know what that is supporting, how that is supporting me. They didn't know that access to work can pay the cost, so that fear can go. You see the loop, like you see the circle, like a couple of actions, practices leading to one another, and finally closing the loop and staying in this fear of cost. So, it started from the fear of cost and led back to the fear of cost. This is one of the practices, like businesses and disabled people were telling me, that is shaping the employment practice in Cornwall. And I called it cost monster because it was just like a monster for them. But as I told you, there is a regulation monster as well. It's not only cost. When I was there, I was saying that, okay, you are not aware of the regulations and supports. One fear is fear of cost. What it leads to, again, they were saying it leads to fear of regulations. Because I'm a small business and I'm afraid of wrongdoings. So the lack of awareness leads to fear of regulations as well. And the same circle is turning now, but this time it's a regulations monster. The previous one was, they are interlinked, but regulations monster and cost monster. There is time of concern or time of monster as well, because they think that disabled people take a lot of time, so it starts another loop of practices indeed. This part of the map is for the employers, but if you go to the other side of the map, you see the same circle of practices for employees, for disabled people and people with long-term health conditions. For example, like they were saying that when I'm not practicing and experiencing inclusive recruitment, what happens? They were telling me that negative attitude that I have got about the disability, I see the disability as incapability. When I'm not practicing it, when I'm not experiencing it, that attitude is not challenged. And I was saying that, okay, what that leads to? That leads to, level of support by SMEs for disabled people. Like what? Like, workplace adjustment. And when workplace adjustment is not there, I was asking what happens? The workability is not restored. Like the environment, the workplace environment is not restoring my abilities to work. And I was saying that what it leads to then? They were saying that it leads to higher rate of resignation. Disabled people come into the workplace, they are not supported because of this loop, the disability as incapability. They resign, self-esteem goes down afterwards, and I was thinking, okay, what happens then? They were telling that because I failed, there is a fear of failure in me now. And that fear of failure leads to lack of motivation to apply. And I'm not motivated to apply anymore because I failed. Lack of motivation to apply means number of people who are applying for the job, disabled people, is low. Rate of disabled people recruitment is low. Do you remember what I told that it leads to? When the disabled people are not applying, the businesses are not experiencing employment. So you see these loops were turning around here because of this lack of experience, and now, this lack of support leads to lack of application. Same thing, it gets back to the main problem. There are a lot of loops as well, like fear of failure. Not only it leads to lack of motivation to apply, it leads to a dilemma that should I reveal my disability or not? Because when I reveal, they don't take me. Should I reveal it? So the disclosure dilemma starts for the disabled. Should I reveal or should I go and then, they will figure out. If they figure out, that what happens, then, I'm rejected again. Same thing. It's lack of self-esteem, fear of failure. You see how system is failing disabled people in terms of employment. A lot of factors are giving hands to each other to shape that, to shape that low level of employment of disabled people and people with long-term health conditions in Cornwall. Okay, the map is complex. I'm not going to go, like this part of the map is speaking about how geography, Cornwall is, dispersed, and it leads to a couple of other things. How geography is shaping that employment practice indeed, or that employment experience. But because of lack of time, I'm just going to jump forward and say that what this map, what are the implications of this map? What are the policy implications? The first policy implication is that don't think that a simple change here would change the complexity. No. We need multi-pronged approach. A lot of things should happen to change it. One policy is not going to work. Two policy is not going to work. We have to sit and ponder on this complexity and design, policies accordingly. But if you take a proper look, you would see that I just tried to map the problem of employment for disabled people, but this system is somehow referring to other systems that I didn't map, like in terms of the geographical dispersion and in terms of access to transport. So transport system is here, but that itself is another complex system. So we have got another complex system I didn't map because it would be much bigger, another complex system there, another complex system for other topics, for other issues indeed. And you see that this issue, employment of disabled people, is a small amount of a huge issues. And it leads to this, that if we want to change this, if we want to improve the employment of disabled people, we have to work with a lot of people in different, different parts of this huge system. And it needs participation. We have to go and speak to them, create a narrative so that those people who are unaware of our complex system, who are unaware of our problems, but they are working in their own world, they would buy our narrative. So not only we need multi-pronged policy approaches, we need a narrative regarding this complexity to sell to them so that they can buy it, because they don't see it. They are in their own world dealing with their own complexity. Like if they go to public transport, people, they have got a lot of other issues that if you map, it would be a complex map for itself. They are working in so we need that, that language indeed, that narrative indeed to sell to them. And the last point is that if someone comes to me and says that, like, I'm working in AI, because I think Kim was telling that AI, If someone comes to me and tells me that AI is coming to Cornwall, I would put this map in front of them and I would say that, tell me how AI is going to influence the employment of disabled people, and it influence in different ways. And then we have to carefully think that what we are introducing to the Cornwall business ecology, because whether you want it or not, the knock-on effect of that intervention would influence the employment of disabled people. So whoever comes to me and shows me policy, I would show this map. And I try to say that how that policy is going to, change this complexity and what it will mean to disabled people employment. So this was for the disabled people, and I don't have time, sorry. How can I go out of this? Can I go to, I would be quicker this time, sorry. Because I told the nitty-gritties of the first one, I'm just going to go to the older people one. And I forgot to say that, look, this complexity is just like for Cornwall. If you go to Exeter, for example, the map would be something different because their geography, their system is, so it calls for context-driven approaches as well, context-driven, policies, interventions. So the same thing for older people over 55. We were thinking that can we map the complexity of older people employment? So like I did interviews again, like that time was 36 for disabled people, but for the older people, 29 with older people, SME owners, HR experts, and policy people, and came up with this map, which is totally like somehow different from the disabled one. Like here, as you see it, again on the left side, the factors and the interactions between those factors are more on the business side. For example, when I was talking to these people that, okay, what conditions shape the employment of older people in Cornwall, they were telling me that, there is a negative attitude to manageability of, older people. I think Carol was telling that if they are more experienced means a negative thing. Really it means because businesses see the more experience as hard to manage, because these people are crystallized in the way of doing the things. So when they were speaking about it, I was saying, okay, what it leads to, they were saying that it leads, when older people with a lot of experience comes to me, and I see that I cannot manage it, that risk awareness comes up. I don't employ. And I was telling that, okay, what it leads to, I'm more intended to employ younger people. When I employ younger people, I don't change the workplace. When I don't adjust it, like I'm not an inclusive SME, I'm not employing older people. When I'm not employing older people, it leads to what? It leads to the same problem, because I didn't experience working with older people to see that they are manageable. I didn't experience it, so not recruiting them fed back on the same problem. And as you see, for the health issue, for the performance issue, they think that older people are not performing well, or they have got health issues. And one interesting thing they were telling me was that when we don't employ, something happens. An interesting loop of practices opens, and that is, people go to benefit dependency. I was saying, okay, then what happens? They were saying that when they go to employment dependency, a gap happens in their CV, in their employment history. And I was saying, okay, what it means? They were saying that when I see the gap, it means for me what? They are not performing well. This guy is not a good working person, well-working person. That's why they have got this gap. So that negative attitude to performance is exacerbated, I can say. And this loop is again starting to work, and that's why you see less older people in employment system in Cornwall. If you go to the right side, all these things are happening for this time on the employee side. One of the interesting thing was that, as I told, geography shapes a lot of things in Cornwall. As the towns are dispersed, the geography is dispersed. long distance between places, so cost of travel is high. And then they were like, I was asking from older people that what happens to you when you are not employed? They were telling me that I feel hopeless. I was saying, okay, hopelessness. What happens then? I go to the benefit dependency, that it created, employment gap here. But here it leads to something else. I was saying, what happens then? They were telling that I'm not able to afford personal car. Because, personal car is expensive, I'm not affording it. And I was saying, okay, what it leads to, it is interesting, what happens to you? They were saying that when I'm not affording it, cost of travel is high for me because I have to take taxi, or like our, public transport system is not good. So there are two choices. I have to take taxi or forget about work because, public transport is not good. So cost of travel is, I'm not able to afford personal car. Cost of travel is very high for me. Workplace is not accessible for me because there is a huge distance between, Newquay and Falmouth. So workplace is not accessible. My perceived chance of employment is low. I say, I cannot go to Falmouth. How can I go to Falmouth? So I'm not motivated to apply. I'm not applying. Level of, recruitment is low, and all these, it leads to what? It leads to all these other factors that all these circle of practices. So again, a complex map here. And if you come with a policy to me, and I would say that, look, that's not as simple. Don't think that if you bring a policy, it would work. It's very complex. We have to think that, what parts of the system that policy is going to influence. And I'm 100% sure that we need a multi-pronged approach, a couple of policies together, a portfolio of policies indeed. Same thing here. I'm not going to repeat what I told in the disability, but I tried to show that tackling the challenges of employing disabled people and older people is not an easy thing because of this complexity. That's why we have been not failing, we have been trying to improve, but a little bit of improvement. Because the complexity is there. That complexity acts as a hurdle. Thank you.